drug profile of spironolactone with full explanations for each section so you have both exam-oriented and clinical knowledge. Heb spironolactone, complete drug monograph. 1. Generic name, drug class, brand name. Generic name, spironolactone. Drug class, potassium-sparing diuretic, aldosterone antagonist, antihypertensive, and anti-androgen. Brand names Aldactone, Carospir, Novospiriton, Spiractin, varies by region. Number 2. Definition. Spironolactone is a potassium-sparing diuretic that acts as an aldosterone receptor antagonist in the distal renal tubules. By blocking aldosterone, it prevents sodium and water retention while conserving potassium. It also exhibits anti-androgenic properties, making it useful in hormonal disorders like PCOS and hirsutism. Number 3. Mechanism of action. Normally, aldosterone binds to receptors in the distal nephron, increases sodium and water reabsorption, plus increases potassium excretion. Spironolactone blocks aldosterone receptors, decreases sodium reabsorption, increases sodium water excretion. Spares potassium, reduces potassium loss in urine. Anti-androgenic action, competes with androgens for receptor sites, decreases testosterone synthesis, increases conversion to estradiol. Net effects: mild diuresis, potassium retention, reduced blood pressure, less fluid overload, improved survival in heart failure, reduced androgen effects. Number 4 uses: cardiovascular, renal, hypertension, mild, moderate, or in resistant cases, congestive heart failure, especially HFrF, reduces mortality, edema due to cirrhosis, nephrotic syndrome, CHF, primary hyperaldosteronism, Conn syndrome, hypokalemia, prevention, treatment, endocrine gynecological, polycystic ovary syndrome, PCOS, reduces androgen effects, hirsutism, excess hair growth, acne, hormonal, female pattern hair loss, off-label. Number 5, indication, FDA approved, hypertension, heart failure with reduced ejection fraction, HFrEF, edema, CHEF, liver cirrhosis, nephrotic syndrome, primary hyperaldosteronism, hypokalemia, when other therapies unsuitable, off-label, PCOS, acne, hirsutism, resistant hypertension. Number 6, contraindications, absolute, hyperkalemia, severe renal impairment, CRCL 30 milliliters per min, anuria, Addison's disease, low aldosterone state, concomitant use with eplerenone, relative, hepatic impairment, risk of encephalopathy, pregnancy, category C, crosses placenta, may cause feminization in male fetus, elderly, risk of hyperkalemia. Number 7, before taking this medicine, precautions. Inform doctor if you have kidney or liver disease, diabetes mellitus, risk of hyperkalemia, electrolyte imbalance, especially high potassium. Avoid potassium supplements or salt substitutes, high potassium diet, bananas, oranges, coconut water, leafy greens in excess. Pregnancy and lactation, may cross placenta, risk to male fetus. Excreted in breast milk, caution advised. Regular monitoring. Serum potassium, renal function, blood pressure. 8. How to use, take orally, with or without food, with food, less GI upset. Take at the same time daily. Swallow tablets whole, liquid formulations available for patients with swallowing difficulty. Do not stop suddenly without medical advice. NASH 9, dosing information. Exact dose individualized by doctor depending on condition. Hypertension, 25 to 100 milligrams per day, single or divided doses. Heart failure, HFrEF. Start 12.5 to 25 milligrams per day, max 50 milligrams a day. Edema, CHF, cirrhosis, nephrotic syndrome, 25 to 200 milligrams per day in divided doses. Primary hyperaldosteronism, 100 to 400 milligram divided. Acne, PCOS, off-label, 50 to 200 milligrams per day, often combined with oral contraceptives. Pediatric rare use, doses based on weight, 1 to 3 milligrams kilograms per day. Number 10, missed dose and overdose. Missed dose, take as soon as remembered. If near next dose, skip. Do not double dose. Overdose, signs, hyperkalemia, dizziness, confusion, GI upset, arrhythmias. Management, stop drug, treat hyperkalemia, calcium gluconate, insulin glucose infusion, dialysis if severe. Number 11, stop or avoid taking. If severe hyperkalemia develops, weakness, tingling, irregular heartbeat, sudden worsening of kidney function, severe allergic reaction, rash, swelling, breathing difficulty, severe dizziness or dehydration. Number 12, side effects common, hyperkalemia, nausea, vomiting, diarrhea, dizziness, headache, gynecomastia, male breast enlargement, menstrual irregularities, women, breast tenderness, fatigue. Serious, rare but dangerous, severe hyperkalemia, arrhythmias, muscle paralysis, Stevens-Johnson syndrome, agranulocytosis, low WBC, hepatotoxicity, liver enzyme rise. Number 13, vital information, monitoring. Monitor regularly. Serum potassium, serum creatinine, renal function, blood pressure, weight, fluid balance. ECG monitoring if hyperkalemia suspected. Educate patient to report symptoms of hypotassium, muscle weakness, palpitations, irregular heartbeat. Number 14, other drugs that will affect spironolactone. Hyperkalemia risk, ACE inhibitors, lisinopril, enalapril, ARBs, losartan, valsartan, potassium supplements, salt substitutes, NSAIDs, ibuprofen, indomethacin, trimethoprim sulfamethoxazole, Bactrim, hypotension, renal impairment, other diuretics, beta blockers, calcium channel blockers. Drug level interactions, digoxin, increased risk of toxicity, lithium, increased lithium toxicity, corticosteroids, may antagonize spironolactone effect. Our summary: spironolactone is a potassium-sparing diuretic and aldosterone antagonist with both cardiovascular and hormonal uses. Its main risk is hyperkalemia, requiring regular monitoring of electrolytes and kidney function. It is widely used in heart failure, hypertension, edema, and hormonal disorders like PCOS and hirsutism. Thank you. Have a nice day.